Hello everyone, in this video I'll be explaining on the topic Ent- Enterobacteriaceae and Mycobacteria. Coming first to the Mycobacteria, the morphology includes they are gram-negative bacilli, non-motile, non-capsulated, and non-sporing. The classification of Mycobacteria are broadly classified into two types, that is, non-cultivable and cultivable. Under non-cultivable is Mycobacterium leprae, and under cultivable it is broadly classified into three types: typical Mycobacteria, atypical Mycobacteria, and saprophytic Mycobacteria. Under typical Mycobacteria, it includes Mycobacterium tuberculosis, Mycobacterium africanum, Mycobacterium bovis, and Mycobacterium microti. Under atypical Mycobacteria, it includes group 1, which are called photochromogens, group 2, which are called scotochromogens, group 3, which are non-chromogens, and group 4, which are rapid growers. Under saprophytic Mycobacteria, it includes Mycobacterium smegmatis, Mycobacterium flea, Mycobacterium stercoris, and Mycobacterium thermo. Coming to the mode of transmission, in case of tuberculosis, it is transmitted by direct inhalation of air containing the bacilli released during coughing, sneezing, or speaking. In case of leprosy, the infection spread from person to person by nasal secretion or respiratory droplets that remain suspended in the air. The mode of prevention here, in case of leprosy, prevention of contact with droplets from nasal or other secretions from patients with untreated Mycobacterium leprae. Infection is currently the most effective way to avoid the disease. In case of tuberculosis infection control including the use of respirators and masks. Collection and transport of samples, in this case of tuberculosis, specimen collected is sputum, and then which is best collected in the morning before any meal. Sputum sample on 3 days increases the chance of detection. Where sputum is not available, laryngeal swab or bronchial washing may be collected. In small children who tend to swallow the sputum, gastric lavage can be examined. In case of leprosy, specimens are collected from the nasal mucosa, skin lesions, and air lobules. Interpretation of sputum stain by ZN stain. First column is the number of acid-fast bacilli seen per oil immersion field, and the interpretation. If no acid-fast bacilli is seen in 100 oil immersion field, that is interpreted as negative. And if about 1 to 9 acid-fast bacilli is seen per 100 oil immersion field, then it is mention the number, how much it is seen. Then about 10 to 99 acid-fast bacilli, if it is seen in 100 oil immersion field, then it is interpreted as 1 plus. If it is seen more than about 1 to 10 acid-fast bacilli per 50 oil immersion field, then it is interpreted as 2 plus. If it comes to more than 10 acid-fast bacilli per 50 oil immersion field, that is interpreted as 3 plus. Atypical mycobacteria are mycobacteria which do not cause tuberculosis or leprosy, but do cause pulmonary diseases such as that resemble tuberculosis. Spread of atypical mycobacterial disease. In this, the method of spread of atypical mycobacteria is uncertain, but it is likely through contamination of broken skin, such as cuts or insect bites, injection of contaminated fluids, contamination of surgical wounds, medical equipment or implants, ingestion of contaminated food or drink, breathing in tiny particles, that is respiratory droplets containing the infectious organism. Next, coming to the Enterobacteriaceae, the morphology, it includes the non-sporine, they are gram-negative bacilli, and members of this family may or may not be capsulated and motile by peritracheate flagella, or some may be non-motile. Classification of Enterobacteriaceae is broadly classified into four tribes. Tribe 1, which is called Escherichiae, where the genus are Escherichia, Salmonella, Shigella, Citrobacter, and Adversilla. Tribe 2 is Klebsiella, where the genus are Klebsiella, Enterobacter, Hafnia, and Serratia. Tribe 3 is Protea, where the genus are Proteus, Morganella, and Providencia. Tribe 4 is Erwinia, where the genus is Erwinia. Coming to the mode of transmission, it can be transmitted or spread through the fecal-oral route, that is, and from person to person transmission can also occur through the fecal-oral route. The method of prevention, it is to prevent the spread. Healthcare personnel and facilities can follow infection control precautions provided by CDC. This includes washing hands with soap and water or an alcohol-based hand sanitizer before and after caring of a patient, carefully cleaning and disinfecting rooms and medical equipment. Collection and transport of samples here. The samples are urine, blood, sputum into a sterile container, and stool sample transported in sac buffered glycerol saline.